Nephrotic syndrome is a disease of urinary system. Nephrotic syndrome is a disease of urinary system. Tramtrack appearance is seen in membranoproliferative glomerulonephritis. Tramtrack appearance is seen in membranoproliferative glomerulonephritis. Voluntary nervous system is also known as dash. Somatic nervous system. Voluntary nervous system is also known as somatic nervous system. The baby teeth begin to erupt by the age of 6th month. The nurse needs to suspect anaphylactic reaction following the IM administration of streptomycin if the patient is complaining of edema and itching at the injection site. Nurses needs to suspect anaphylactic reaction following the IM administration of streptomycin if the patient is complaining of edema and itching at the injection site. Physical and chemical changes or reactions that occur within the body are collectively known as metabolism. Physical and chemical changes or reactions that occur within the body are collectively known as metabolism. Most effective approach to treat benign tumor is surgery. Most effective approach to treat benign tumor is surgery. Name the microorganism which is most commonly responsible for meningitis among 6 months to 2-year-old children. Streptococci. Name the microorganism which is most commonly responsible for meningitis among 6 months to 2-year-old children. Streptococci. The basic unit of life is cell. The basic unit of life is cell. How much blood is drawn from a donor when 1 unit of blood is donated? 400 ml. How much blood is drawn from a donor when 1 unit of blood is donated? 400 ml. A thoracentesis is performed on a chest-injured client and no fluid or air is found. Blood and fluids is administered intravenously, but the client's vital signs do not improve. A central venous pressure line is inserted and the initial reading is 20 cm H2O. The most likely cause of these findings, which is pericardial tamponade. A thoracentesis is performed on a chest-injured client and no fluid or air is found. Blood and fluids is administered intravenously, but the client vital signs do not improve. A central venous pressure line is inserted and the initial reading is 20 cm H2O. The most likely cause of these findings is which? Pericardial tamponade, which represents the most appropriate nursing intervention for a client with a pruritus caused by cancer or the treatments. Medicated cool bath, which represents the most appropriate nursing intervention for a client with pruritus caused by cancer or the treatments. Medicated cool bath. Hypervitaminosis of dash cause signs and symptoms such as headache, vomiting, vertigo, diplopia, and skin discoloration. Vitamin A. Hypervitaminosis of dash cause signs and symptoms such as headache, vomiting, vertigo, diplopia, and skin discoloration. Vitamin A. The most important test the nurse should check to determine whether a transplanted kidney is working. Serum creatinine level. The most important test the nurse should check to determine whether a transplanted kidney is working. Serum creatinine level. Holter monitoring means dash. Ambulatory ECG. Holter monitoring means dash. Ambulatory ECG. Peptic ulcer caused by Helicobacter pylori is treated with ranitidine and antibiotics. Peptic ulcer is caused by Helicobacter pylori is treated with ranitidine and antibiotics. Glaucoma management focus upon increased outflow of aqueous humor. Glaucoma management focus upon dash increase outflow of aqueous humor. Glaucoma management focus upon dash increase outflow of aqueous humor. Primary muscle of breathing is dash diaphragm. Primary muscle of breathing is dash diaphragm. Earliest sign of glaucoma is dash halos around the eyes. Earliest sign of glaucoma is dash halos around the eyes. Most common and life-threatening complication of SLE is dash nephritis. Most common and life-threatening complication of SLE is dash nephritis. Destruction of alveolar walls is known as dash emphysema. Destruction of alveolar walls is known as emphysema. Abnormally increased proliferation of normal cells is termed as hyperplasia. Abnormally increased proliferation of normal cells is termed as hyperplasia. Ringing sensation in the ear is termed as dash tinnitus. Ringing sensation in the ear is termed as dash tinnitus. On admission, the laboratory values of a young male client with leukemia indicates an elevated blood urea nitrogen or BUN and uric acid. This indicate dash. Hypermetabolic state. On admission, the laboratory values of a young male client with leukemia indicates an elevated blood urea nitrogen or BUN and uric acid indicates dash. Hypermetabolic state. First heart sound indicates onset dash. Ventricular systole. First heart sound indicates the onset of dash. Ventricular systole. Sawtooth appearance of ECG wave is seen in atrial flutter. Sawtooth appearance of ECG wave is seen in dash. Atrial flutter. Most common intrarenal cause of acute renal failure is acute tubular necrosis. Most common intrarenal cause of acute renal failure is dash. Acute tubular necrosis. Most common intrarenal cause of acute renal failure is acute tubular necrosis. Respiratory function is measured by dash. Spirometer. Respiratory function is measured by dash. Spirometer. Most common intracranial tumor is dash. Glaucoma. Most common intracranial tumor is dash. Glaucoma. Which surgery is performed for chronic otitis media? Tympanoplasty. Which surgery is performed for a chronic otitis media? Tympanoplasty. Gallow's traction is used for dash. Fracture of shaft of femur. Gallow's traction is used for dash. Fracture of shaft of femur. Flushed cheeks can be seen in patient with dash. Mitral stenosis. Flushed cheeks can be seen in patient with dash. Mitral stenosis. SpO2 indicates dash. Percentage of oxyhemoglobin. SpO2 indicates dash. Percentage of oxyhemoglobin. Alopecia means dash. Loss of hair. Alopecia means dash. Loss of hair. Most common early clinical manifestation of ARDS are dyspnea and tachypnea. Most common early clinical manifestations of ARDS are dash. Dyspnea and tachycardia. Most common early clinical manifestations of ARDS are dash. Dyspnea and tachypnea. Dyspnea and tachypnea. Thanks for watching. PSC Nurseന്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ഈ ചാനൽ ലൈക്ക് ചെയ്യുകയും
നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. ധാരാളം വീഡിയോസ് PSC Nurse എന്ന ഈ ചാനൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോസ് റിപ്പീറ്റ് ചെയ്ത് കാണാൻ ശ്രമിക്കുക. അത് നിങ്ങളുടെ ഓർമ്മയെ കൂടുതൽ ശക്തിപ്പെടുത്തും. നന്നായി പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നന്ദി, നമസ്കാരം.